here's the reason why. This process works really, really well for what I would describe as a normal, uncomplicated birth. But what I mean by that is that there isn't medical intervention that's absolutely necessary.
Right.
And I say simply that if all women in those circumstances could have their birth in this way, then the doctors' and nurses' time could be more properly used in those situations where their presence is absolutely required,
right.
because there are complications
right.
that require the interventions of doctors and nurses for the safety of the mother and the child.
Right.
And but that's not the majority.
Right.
So it would be a better use of the doctors and nurses' time.
Absolutely. But speaking of that, I mean, is there any, contraindications to using hypnosis? Obviously, if a doctor says no, that there's a real medical problem and so forth, you have to do what the doctor says. But do you know of any, contraindications?
I don't know any specific contraindications. Obviously, there are areas where if there's the baby's transversal breach,
right.
then these days, almost invariably, that baby's going to be born by C-section.
Right.
Very, very few. I don't even know if anybody's willing to do a breech birth anymore.
Right.
Sometimes something called a VBAC, a vaginal birth after C-section. That's usually going to. It doesn't have to be a vaginal birth after C-section is that, but most women that have had a C-section, very often the hospitals or their insurance or their doctors are going to recommend or even require a C-section. Now, we can do pre and post surgery hypnosis because it is a form of surgery to make the experience better, to increase the
right.
rate of healing.
Right.
But then techniques that we're talking about here are for people who are going to have a vaginal birth.
Right.
And but on that speed thing, and we know, fortunately not one of my clients, I have to say, but somebody who gave birth using hypnosis, it happened so fast, she literally had the baby out. She never got a chance to get to the hospital.
Yeah.
I mean, she just didn't get there.
Yeah.
She had that, she literally went to the bathroom, had the baby there.
Yeah.
And it was, that's a little bit, we don't want that necessarily.
Right, exactly.
But
right.
Just as an indication of how easy and straightforward it can
right.
be.
Right. So let's talk about, we said, well, okay, major medical issues, no.
Right.
But, and breach, like you say, and so forth. But who would be actually a good candidate for the process? Because they have to be, we've got all the myths that I can't be hypnotized and
right.
things like that. So what's good?
I would say any healthy woman, healthy woman and a healthy baby who wants to have a vaginal birth and who wants to have that vaginal birth without extraneous medication in the form of epidurals, nitrous oxide, other painkillers. Anybody in those circumstances can do this.
Right.
It simply requires some input, some practice from the mother.
Right. But I want to say something really quick about that.
Sure.
An important point here is, if they choose this, that doesn't mean that if things aren't going well or this or that, they can't have an epidural,
absolutely.
Nitrous or whatever it is.
Yes.
So it doesn't preclude any of that. So you're not be afraid, you go down this path, you're taking out all the other options.
No, absolutely. And this is exactly the same for anything in which potentially chemical anesthesia is necessary.
Right.
Just in the same way, I mean, if you're going to use hypnoanesthesia for a procedure, the doctors or dentists test to see if they have sufficient levels of anesthesia.
Right.
They're not going to begin operating on somebody without making those tests, of course not. In the same way, we ensure that people have the capacity to test themselves for their state of anesthesia. Now, of course, they can't test themselves for the anesthesia during birth until it comes to the birth, but we give them ways in which they can test their degree of anesthesia. Because learning this process, we're going to show people how to anesthetize themselves from about the top of the line of the breast down to about the lower level of the thigh, just below the groin, back and front.
Right.
They're going to learn this process.
But let's be clear, because
of course.
Anesthesia has a broad understanding.
Yes.
Because in using hypnosis, there are different forms.
Yes.
If you can actually do major surgery, and that's a general anesthesia kind of a thing. When we use it for childbirth, we're not numbing it from here to here.
Right.
We're just removing pain sensations.
Right. Now, I will say that in certain areas it will feel numb. There will be a numbness. They may feel movements, but there won't be a pain response. But here's the key thing: we're only talking about from here to here. What does that mean? That means you can talk, you can walk, you can move your arms around, you'll be able to engage with the doctors and nurses. You won't be like this, in a state totally out of it.
Right.
You'll be there. So it's very, very specific.
Right.
And selective.
And the thing is that if a medical problem arises and a pain sensation is caused by the body to alert the doctors and the woman that there's something going on, that's not going to be blocked.
No.
You know, it's
Of course not.
because your subconscious would not allow that.
No,
You know,
no.
It would know there's something different going on here, and I need to let this through.
Yeah, and all the things that the good parts of modern medicine and health that are able to bring to a mother, if necessary, are going to be available to that mother. There's nothing that we ever do that masks or disguises anything.
Right.
In that way.
Exactly. And it's basically because we work with the conscious and the subconscious, but a lot of it is subconscious.
Right.
And its primary role is to protect the person.
Yes.
And it won't take suggestions that are going to result in harm.
Right.
So let's talk about the process. Like, how long does it take? Do they have to practice this? Because you mentioned a little bit about testing it before. Why don't you describe the process?
So the ideal is that a baby's born at normally around about 40 weeks, and so ideally I would prefer to see mothers somewhere between week 26 at the earliest and week about 30, 35, 36 at the latest. So around about 30, 35 weeks is ideal. Now the reason is because we use in this process a 3-step process.
Right.
In the first step, we want to bring people into deep trance, and one of the key things that we do is not only condition them for deep trance, but we want to give them suggestions which are going to ensure that some of those very negative messages that they may have received about birth and may still be receiving about birth just don't have any effect upon them.
Right.
And sometimes people with the best of intentions can give some very, very negative messages about birth. They'll say things like, oh, well, it'll be one of the worst periods of time you've had, but don't worry, it'll all be worth it. You'll feel so good. Or you'll forget about what terrible pain you were in, or worse to that effect.
Right.
And we want these suggestions just to wash off people like water washes off a duck's back.
Right.
So we condition them and we give them almost like an armour plating against these things, mentally and emotionally.
Right.
Then the next part of the process is we want to show them how to bring themselves into deep trance, and to then, having learned how to do that, to selectively, and I'm going to use the word anaesthetise, given the limitations that we said, just as shorthand, in a certain section of the body, and then how to test it.
Right.
Now, I found that it's usually necessary for people to practice that. Well, how much do they have to practice it? I like to say that ideally somebody should be practicing about 10 minutes a day, if they can a little bit longer, bringing themselves into that state repeatedly. And that's why we'd like to see some women coming to us a few weeks before the birth, so they've got time to practice it. There's going to be lots and lots of things that they have to do to prepare for birth. Now, as anybody that's given birth knows, when that last month comes, you could give birth any time in that last month. Even you might give birth at 40 weeks, 41 weeks. You might give birth at 38 weeks or 39 weeks. So we want to. That's why I say ideally 30, 31, 32 weeks is a good time to come. Then you've got time to practice these methods and techniques.
Right.
Though saying that, one of my clients who came to me for something else, a young woman, a long time ago, I did some routine follow-up with her, and I said, how are you doing? And she said, I'm doing fine, I've been very busy, but with the baby. And I said, what baby?
Right.
I didn't know. And she said, oh, well, it hasn't come yet, I'm a week overdue. And she was very concerned about it because there was considerable pressure on her to have the birth induced, and she didn't want to have the birth induced. And so I said, why didn't you call me? You can have this baby pain-free. She said, really? Pain-free, is that possible? And she said, yes, and everything. Now she came, and she had to do a lot of work because that baby could have come at any time.
Right.
As it turned out, she had the baby about 3 days after she saw me. So she'd only had 3 days to practice these methods.
Right.
She had the baby without any medication, without any epidural. And she had the baby. Now, was it the most ideal, most pain-free that I've ever seen? No. But she was able to have the baby,
Right.
even with very, very, very little pre-birth work.
Right.
But that's not ideal.
Right.
Ideally, you want to be able to put some time into it.
Right. Now, talk about, how many sessions do they have to actually come and see you
3.
or me?
Right, 3 sessions.
Yeah.
It's we have our program is a 3-session program.
Right.
Occasionally, there's a 4th session is necessary, but mostly it's a 3-session program.
Right.
And those sessions are usually spaced a week to 2 weeks apart. Usually a week before the first couple of sessions, sometimes a couple of weeks after that,
Right.
depending upon when the baby's due. I like to ensure that all of the sessions are completed about 3 weeks before the due date, if possible.
Right.
Sometimes it doesn't allow for that. And what the mother is going to be experiencing, not just the capacity to self-anesthetize, but to enter deep, deep states of relaxation.
Yeah.
One of the mothers, almost all the mothers tell me that as soon as they enter deep hypnotic states, the babies get very active. They move around a lot. And I, for a long time, I wondered why that would be. And it may be, and this is just a hypothesis, that when the mother's very relaxed and the muscles are relaxed, there's just a little bit more room in there for the baby to move around, because it gets pretty tight in there at a certain time.
Yeah. Yeah.
And so they're learning that technique.
Right. So the first session they come in and you bring them into a deep trance. You show themselves how to bring themselves in.
Yep.
And then they practice in between.
Yep.
Like a week later, they come back in again.
Right.
And you do checks with them to see
Right.
how are they doing it.
Right. And then they practice, the next stage is they practice this selective anesthesia.
Right.
They have to be able to bring themselves into deep trance consistently first, and we teach a very, very simple methodology.
Right.
And again, we talked at the beginning of the show about regression things. There's no regression involved in this.
No.
This is the simple use of hypnotic technique and relaxation and things like that.
Right.
And so we show them how to do this. Some people can do this. There are some programs that do things in a day or a session. Sometimes you can do things over a long weekend because time necessitates that, as in
Right.
the case of the client that had a very short period of time. I had to see her one day after another. That's possible, it's not ideal. In that instance, the person just has to do a lot more self-hypnosis. So
Right.
I asked her to do as much as, an hour a day if she could, because she could have given birth literally when just leaving the office.
Right,
So
exactly.
I didn't
Yeah.
know. But that's not ideal. But one thing I do want to emphasise to people is it's not as if you need to spend hours and hours and hours practicing this. It's a few minutes, and it's a very pleasant few minutes.
Right. Exactly. It just, as you and I both know, we use self-hypnosis.
Right.
Just doing it, if you're just doing it for relaxation, it's
Right.
very deeply relaxing.
Right.
And so it's actually an enjoyable thing to do.
Right.
So basically, you teach them the deep hypnosis, and then they come back, and then you have them practice the
Yeah, and there's a couple of other things as well. On the final session, there's a particular role that I ask the father or the partner, whoever's there, to play.
Right.
Now, I want to emphasise to everybody listening to this, the father or partner does not need to be present at the birth for these techniques. The hypnotist does not need to be present at the birth
Good
for
point.
these techniques.
Yes.
They can be, but it's not necessary.
Right.
We're showing you how to do this yourselves. In the old days, and the hypnotists were present, but that's not necessary.
Right.
So we show you how to do this yourselves. Now, if, for example, where we are, we're close to 2 military bases, a Coast Guard base and a Navy base.
Right.
And it turns out that sometimes those military personnel are on deployment and the fathers can't be present at the birth
Right.
because they're somewhere else.
Right.
So sometimes women ask me, does he have to be present for this to work? In other words, and the answer is no. It's helpful, and frankly, it gives them something to do,
Right.
but it's not absolutely necessary.
Right.
This process is very, very robust.
Yeah, I just want to say something else, because there is a bit of fear about trying to use hypnosis for some women.
Yes.
And they think, if I go down this alleyway, I can't go back. And actually, they can shut this anesthesia on and off at will.
And that's exactly what we haven't practiced doing.
Exactly. And
Right.
so the fact is, if they were there and they didn't like, the fact that they weren't feeling the pain, they can shut it off.
Yeah,
in an instant.
if you want to feel pain, nothing's going to
Right,
stop
you
you.
just shut it off, and you're back to, okay, you feel everything. And,
As in all of our processes, our aim is to give you control.
right, that's what I want to emphasize.
And perhaps I should say, who's an ideal candidate for this process? It's a woman and their partner who want to have control of the birthing process.
Right.
If you're the sort of person that just says, hey doc, hey nurse, just give me the medication, I don't want to know anything about it, I don't care, as long as I'm safe, the baby's safe and it's all over, this process isn't for you.
Right.
This is for people who want to be active, knowledgeable participants in the process, who want to control their birthing experience.
Right.
Because it's their experience and the baby's experience, it's the family's experience. It's an extremely powerful bonding time.
Right.
I do believe, and I'm not the only one that believes it, that birth has become an over-medicated process. Sometimes it's viewed almost like a piece of surgery or a procedure. And instead of being the highly emotional, bonding, nurturing, caring process that I believe it's supposed to be. And that's the experience that we're looking for our clients, the ladies, to have.
Right.
A happy time, a joyous time, so that the birth is looked back on as something fulfilling.
Right. I know Jane, our client on the tape, said she just thought it was wonderful.
Right.
You know, and so the other thing, talk about you do a session after the birth.
Yes, this is also very important. You don't have to have this, but I suggest that afterwards there's a session after the birth. That's for a couple of reasons. Sometimes, occasionally, although not frequently during what we do, but occasionally a episiotomy is necessary, and sometimes for the healing and repair of the mother. Also, just a general sense of well-being for the baby. We also do things to help hypnotically ease the process of breastfeeding. Breastfeeding in our culture at the moment is very heavily encouraged. I personally believe it's, as many doctors and nurses do, it's just about the healthiest process and a wonderful bonding process for mother and child. But it's not always easy for people to do that, and we've been able to help that a little bit with hypnotic technique. Obviously, you know, those people are going to be coached by lactation consultants and other supportive people to help in that.
Right. Again, if you use this, it doesn't preclude other methods.
Of course not, no.
You know?
What we do is an adjunct to. Now, there's one thing I will say, and what I'm about to say may upset a few people out there, so here it goes. Most of the people that don't like what we do are doulas. For those of you that don't know, doulas are assistants there at the birth. Now, why don't doulas like what I do? Well, most doulas are there to help you manage pain. Well, if there's nothing to manage, then you haven't got a job, have you?
Right.
And so at first, when I was first doing this, I thought that these people would be the most interested in encouraging doulas, you know, but there's nothing for them to do, right?
Right.
We're not there to manage pain. I want to really emphasise this. This is not like Lamar's where you're breathing in and out and very rapidly like a panting dog to manage pain. You won't experience pain and discomfort.
And it's not that you can't have a doula present, but they're not going to have.
If they're going to have a doula present, they have to know what we've been doing, how we've been doing it, so they don't say and do things which are contrary to what we're, you know, to what we're doing. Because most birthing techniques that are not hypnosis in the way that we're talking about, and I want to talk about the difference between hypnosis and something that looks like hypnosis and not before we go.
Yes.
Are pain management techniques. We are not talking about pain management. If you are doing the sort of hypnosis that we are talking about and doing it genuinely, you won't experience that pain. It's as simple as that.
Right.
We don't want you to manage pain. We don't want you to have pain. We want it to be joyous, happy, fulfilling, completely different.
Right. Exactly. So again, it doesn't preclude things, but like you say, they have to be well informed about what's going on. Now we do, again, doctors and nurses may say things that are contrary to it. You know, like they talk about pain and things like that.
How much pain are you in? Or
exactly.
Tell me what pain. And they sometimes have to ask these questions. They're literally required to do so. Right. So that, you know, they have to take a measurement of pain. But
that's why we have that where we tell their subconscious it'll just wash off like water off a duck's back, because unfortunately you can actually people who are going through things a lot of times are in a light hypnotic state already.
Yes.
And if you say, "Oh, it'll be only a little bit of pain," it's basically you're telling their
it's going to be pain.
There's pain.
Right.
And,
What's a little bit?
Right. What's a little bit? Right. And it's just like when they go to give you a shot. Oh, just a little pinch. Well, it's actually the worst thing to say, because it actually will cause pain where there really probably wouldn't be much.
Yeah. So sometimes say this is going to hurt, but I'll try and be as quick as possible.
Right. Right.
So it's like, okay,
right.
I'm going to experience pain.
Right. Right.
But one of the things I really want to emphasise is we've been talking about the hypnosis that we do.
Right.
And there is at least one very famous technique out there, and I don't know if I'm going to get myself into trouble for mentioning it, but it's called hypnobirthing. It's a great name, but I'm going to say on the air and directly, this is not hypnosis in the way that we're talking about it here. I'm sorry, it's not. It's a form of creative visualisation, but it is not hypnosis in the sense of the bypass of the critical faculty and the admission of acceptable selective thinking. Now, as I say, it's a great name, but my issue is for most women, it just doesn't deliver. Pardon the pun. It doesn't produce a pain-free experience, but what it does is it puts people off the idea of using hypnosis. Unfortunately, there is no commonly acceptable definition of hypnosis. I've just given you the one that we use, which is, if you've listened to this show before, is based upon our teacher's teacher, Dave Ellman. But even though the Department of Labour uses it, it's not the universally accepted definition of hypnosis.
Right.
But to find to create the emotional, mental, physical conditions that we require, you need to have somnambulism in the sense that we mean it.
Which is a deep hypnotic state.
Right. And some of these so-called methods and techniques do not do that.
Right.
Now, there is a good program, there are other programs out there that do deliver that. I'm not saying that we're the only people that have that program.
Right.
But I'm saying that one needs to ensure that the person understands how to bring their client into a deep hypnotic state. One of my issues, there's a very good program out there that an excellent hypnotist who's now passed away, Gerald Kine, he started the program. It's a marvellous program, and it's promoted under something called Hypno Babies. There's nothing wrong with the program. It's a good program. I like the program. I just have a couple of issues, not with the program, but just sometimes I question how much training and practice the people have received. I know that the people in Hypno Babies do the best to, ensure that their people are trained and practiced. But we're doing this as hypnosis practitioners, hypnosis all the time.
Right.
We're doing it constantly. We're bringing people into hypnotic states. It's not something that we do as a sideline. It's not something that we do sometimes here. A lot of the people that have learned some of the birthing methods and techniques the hypnosis connected with birthing and techniques, it's a sideline for them. They may be midwives, they may be Reiki practitioners or other health practitioners. But the question you want to ask yourself when choosing a program is this person a hypnotist who has experience of bringing people into a somnamblistic state?
Right, a deep state.
Because unless you get that, you are not going to be able to experience that hypno-anesthesia that you need.
Right.
And you'll have a miserable experience, and we don't want you to have a miserable experience. We want you to have a lovely experience.
Right, because you might be brought into a light hypnotic state, the medium, but unless you get down to the state of somnambulism, the suggestions just don't go in like
Absolutely. And we've said it many times on the show, and we'll say it again. You may be very relaxed.
Right.
But that does not mean you are in a hypnotic state. Right. And if you think that you can just relax yourself enough that you won't experience discomfort without the use of the methods that we and others training this way have used, you're deluding yourself.
Well,
right?
This is the thing. Like
you'll just be relaxing in pain.
Right. When I used anesthesia for dental work, if I told my conscious mind or in a light hypnotic state, oh, you won't feel anything, right? It wouldn't have worked.
Right.
You can tell yourself all you want, I won't feel pain, I won't feel pain. But if you're only talking to the conscious mind or in a very light hypnotic state, it's not going to do anything.
There is a process. It's not a complex process.
Right.
It's not a process that is difficult to learn. It's a process that anybody can learn, assuming that they want it, they're open to it. You just have to practice certain things, but it is a process. And it's very easy to get it mixed up with other processes that appear to be similar,
Right.
superficially, but don't deliver the same results.
Is one of the programs you mentioned, do they use CDs or something like that?
Yeah, and again, I don't have an issue in itself with using CDs, sometimes to reinforce. Sometimes people don't have access to a hypnosis practitioner, and the only way that they can learn something is by doing a self-study program. But here's my question. How do you know if on a self-study program whether you're doing it correctly?
Right.
When you're working with a hypnosis practitioner, we are monitoring you, looking at you, coaching you, testing you, supporting you, making sure that you're doing it correctly. Because when do you want to find out? At the birth?
Right.
Right? Oh, I wasn't doing this correctly. So again, it's the difference between a self-study course and having a trained expert work with you to ensure that you get what it is that you want.
That's right, and the testing is a very important part. And when we say
Yes.
testing, basically we bring a person down into hypnosis, and we do certain tests to ensure they're in the state of somnambulism.
And then they have to bring themselves into that state,
Right.
and we test to make sure that they can do it as well.
Right.
So it's not just a question of, hey, see us for a few sessions and buy and have good luck, or here's a tape, listen to this, it'll do it all for you.
Right.
And by the way, in the processes that we use, you can use tapes if you want to, but you won't need to doing what we do. If you practice what we do, you'll, everything that you'll have will be self-contained, it'll be within you, and it can never be taken away from you.
Right.
So if it's your first child, that's wonderful. You can then use the process for every child. I recommend between births a little bit of a tune-up, sometimes seeing us. Cause
a single session just to refresh, make sure you're doing it. Because if it's a year, 2 years, or whatever, you know, and you haven't used them at all, you want to make sure they're tuned up properly.
Right, exactly. Because these processes require maintenance a little bit.
Yeah. And that's not hard. That's very easy. If they come back in for one session for a second or third child, it's very quick. It's very easy. You make sure that they got it on track and they can do it, and then they just go along.
Yeah. So it's a skill. It's a technique. And another thing that you'll discover as a result of, as mothers discover, it's a wonderful way for them to bring themselves deep periods of happiness and relaxation during their pregnancy.
Right.
And pregnancies, particularly in the last trimester, can become very, you know, as women, as it comes towards the end, it can become very uncomfortable. And so to have those periods of deep relaxation and feelings of well-being as they're practicing this is marvellous, to give them the confidence, and this all helps the baby as well.
Right.
So one thing I just wanted to emphasise again, and I hope I say this on the air, is if anybody either communicates with us directly or the studio, Atlantic Broadband here, I'd be happy to send them a link to an interview with one of our clients, and just to give you guys a flavour for it.
It was a good experience. I don't know if we've only got a second left. Do you do these in group? Do you do them singly?
I'd prefer to do them singly. They have been done in groups in the past. I just find doing things singly, one-on-one, is much more effective for people.
Right.
We can do it both ways, but I prefer to do it one-on-one.
Right.
I found it to be more effective.
Yeah. Okay. Good.
So, for those of you out there who are pregnant or who know somebody who is, encourage them to explore this and examine this. It's a wonderful experience. I wish it was just more widely done and more widely known. You don't have to use chemical anaesthesia. You don't have the downsides of epidurals and all of those things. Thanks for watching.